Hello and welcome. If you're watching this video, you've taken an important step toward managing a health concern that affects millions of people worldwide. Incontinence, the involuntary loss of urine or bowel control, is far more common than many people realize, especially among older adults. Yet despite how widespread it is, it remains a topic that many feel uncomfortable discussing, even with their doctors or loved ones. Today, we're going to change that conversation. We're going to talk openly, honestly, and compassionately about incontinence, and most importantly, we're going to focus on how you can manage it while maintaining your dignity, independence, and quality of life. First, let's be clear about something. Having incontinence does not make you less of a person. It doesn't diminish your worth, your intelligence, or your right to live a full and active life. It's a medical condition, just like diabetes, high blood pressure, or arthritis. And like those conditions, it can be managed effectively with the right knowledge, tools, and support. Throughout this video, we'll cover the different types of incontinence, explore practical management strategies, discuss products that can help, and most importantly, we'll talk about how to maintain your emotional well-being and social connections while dealing with this challenge. Understanding incontinence. Let's start by understanding what incontinence really is and why it happens. Incontinence occurs when the muscles and nerves that control your bladder or bowel don't work together properly. This can happen for many different reasons, and understanding the cause can help guide the most effective treatment approach. There are several types of urinary incontinence. Stress incontinence occurs when physical activity or movements like coughing, sneezing, laughing, or lifting put pressure on your bladder. This type is particularly common in women who have given birth, as pregnancy and childbirth can weaken the pelvic floor muscles. Urge incontinence, sometimes called overactive bladder, happens when you feel a sudden, intense urge to urinate, followed by involuntary loss of urine. Your bladder muscle contracts when it shouldn't, giving you little time to reach a bathroom. Overflow incontinence occurs when your bladder doesn't empty completely, causing it to overflow. This can happen when the bladder muscle is weak or when something blocks the flow of urine. Mixed incontinence is a combination of stress and urge incontinence, which is quite common, especially among older women. Functional incontinence isn't necessarily caused by a problem with your bladder or urinary system. Instead, it happens when physical or mental limitations prevent you from reaching the bathroom in time. This might be due to arthritis making it difficult to move quickly, dementia affecting your awareness of the need to urinate, or medications that affect your mobility or mental clarity. Bowel incontinence, also called fecal incontinence, involves the inability to control bowel movements. This can range from occasional leakage when passing gas to complete loss of bowel control. It's important to understand that incontinence isn't an inevitable part of aging. While it does become more common as we get older due to changes in our bodies, it's not something you simply have to accept. Many causes of incontinence can be treated or significantly improved. Causes and risk factors. Understanding what might be causing your incontinence can help you and your healthcare provider develop the most effective treatment plan. There are many potential causes, and often, multiple factors contribute to the problem. For women, pregnancy and childbirth are significant risk factors. The weight of the baby during pregnancy and the physical stress of delivery can weaken the pelvic floor muscles and damage nerves that control bladder function. Menopause also plays a role, as declining estrogen levels can affect the tissues of the urinary tract. For men, prostate problems are a common cause. An enlarged prostate can block the flow of urine, leading to overflow incontinence. Prostate surgery, while often necessary, can sometimes damage the muscles or nerves that control urination. Certain medications can contribute to incontinence. Diuretics, which are often prescribed for high blood pressure or heart conditions, increase urine production. Sedatives and muscle relaxants can interfere with the signals between your brain and bladder. Alpha blockers, used for high blood pressure and prostate problems, can affect bladder control. Medical conditions like diabetes can damage nerves that control the bladder. Neurological disorders such as Parkinson's disease, multiple sclerosis, or stroke can disrupt the communication between your brain and bladder. Chronic constipation can put pressure on the bladder and affect its ability to empty completely. Sometimes, incontinence can be caused by temporary factors like urinary tract infections, severe constipation, or certain foods and drinks that irritate the bladder. The good news is that when these temporary causes are addressed, the incontinence often improves or resolves completely. Maintaining dignity and emotional well-being. Perhaps the most challenging aspect of dealing with incontinence isn't the physical symptoms. It's the emotional impact. Many people experience feelings of shame, embarrassment, and loss of dignity. These feelings are completely understandable, but they don't have to define your experience. The first step in maintaining your dignity is changing how you think about incontinence. This isn't about something you've done wrong or a sign of weakness. It's a medical condition that deserves the same matter-of-fact approach you would take toward any other health issue. Many people find it helpful to remember that incontinence affects people of all ages and backgrounds. Athletes, celebrities, teachers, doctors, and people in every profession deal with incontinence. You are not alone, and you are not unusual. It's also important to recognize that your worth as a person isn't determined by your bladder or bowel function. You are still the same person with the same intelligence, wisdom, sense of humor, and capacity for love and relationships. Incontinence doesn't change who you are at your core. However, it's also perfectly normal to grieve the changes in your body and the impact on your life. Allow yourself to feel disappointed or frustrated when needed, but don't let these feelings overwhelm you or prevent you from taking positive action. One of the most powerful tools for maintaining dignity is preparation and planning. When you feel prepared and in control, you're more likely to feel confident. This might mean always knowing where the nearest bathroom is, carrying a small bag with supplies, or wearing appropriate protective products. Many people find that being selective about who they share this information with helps them maintain their sense of privacy and dignity. You don't owe anyone an explanation about your health conditions. Choose trusted friends or family members who are supportive and understanding. Consider connecting with others who understand what you're going through. Support groups, either in person or online, can be incredibly valuable. Hearing how others have successfully managed their incontinence can provide both practical tips and emotional support. Remember that asking for help when you need it is not a sign of weakness. It's a sign of wisdom and self-care. Whether it's asking a family member to help you research products, requesting assistance from a healthcare provider, or accepting help with household tasks so you can focus on your health, reaching out for support is an important part of managing any health condition. Finally, don't let incontinence prevent you from doing the things you enjoy. With proper management and preparation, you can continue to travel, socialize, exercise, and pursue your interests. The goal isn't to hide your condition, but to manage it so effectively that it doesn't control your life. Practical management strategies. Now let's talk about practical strategies that can help you manage incontinence effectively. These approaches can often significantly improve your symptoms and give you greater control over your daily life. Bladder training is one of the most effective techniques for many people with urge incontinence. This involves gradually increasing the time between bathroom visits to help retrain your bladder to hold more urine. Start by noting your current pattern of urination. Then try to delay urination by 15 minutes when you feel the urge. Gradually increase this delay time as your bladder adjusts. Scheduled bathroom breaks, also called timed voiding, can be particularly helpful for people with functional incontinence or those caring for someone with dementia. This involves going to the bathroom at regular intervals, such as every 2 hours, rather than waiting for the urge to strike. Pelvic floor exercises, often called Kegel exercises, can strengthen the muscles that support your bladder and bowel. To perform these exercises, tighten your pelvic muscles as if you're trying to stop urination midstream. Hold for 3 to 5 seconds, then relax for 3 to 5 seconds. Work up to holding the contractions for 10 seconds at a time. Aim for at least 3 sets of 10 repetitions daily. For men, the technique is similar, but focus on tightening the muscles that would stop you from passing gas. It's important to make sure you're exercising the right muscles. Avoid tightening your abdominal, thigh, or buttock muscles. Diet and fluid management can play a significant role in controlling incontinence. While it's important to stay adequately hydrated, you might need to adjust when and how much you drink. Try to limit fluids 2 to 3 hours before bedtime to reduce nighttime episodes. Certain foods and beverages can irritate the bladder and worsen incontinence symptoms. Common irritants include caffeine, alcohol, citrus fruits and juices, tomato-based products, spicy foods, and artificial sweeteners. Consider keeping a diary to track which foods might be triggering your symptoms, and then try eliminating them one at a time to see if your symptoms improve. For people with constipation-related incontinence, increasing fiber intake and staying well hydrated can help regulate bowel movements. However, increase fiber gradually to avoid gas and bloating. Weight management can also be beneficial. Extra weight puts additional pressure on your pelvic floor muscles and bladder. Even a modest weight loss can sometimes lead to significant improvement in symptoms. Good bathroom habits are important too. Take your time when urinating or having a bowel movement. Don't rush, and make sure you're fully emptying your bladder. For women, leaning slightly forward while urinating can help ensure complete emptying. Consider the timing of medications that might affect your bladder or bowel function. If you take diuretics, for example, time them so that their peak effect doesn't interfere with important activities or sleep. Products and aids. Today's incontinence products are far more advanced, comfortable, and discreet than ever before. Understanding your options can help you choose products that fit your lifestyle and provide the protection you need. Absorbent products are available in many different styles and absorbency levels. Disposable underwear, sometimes called pull-ups, look and feel most like regular underwear and are good for people who are mobile and want maximum discretion. They come in different absorbency levels, from light to maximum protection. Adult briefs, sometimes called adult diapers, offer maximum absorbency and are often best for people with heavy incontinence or limited mobility. Modern versions are much more comfortable and less bulky than older designs. Pads and liners can be worn with regular underwear and are good for lighter incontinence. They come in many sizes and absorbency levels, and many have adhesive strips to keep them securely in place. For men, there are specially designed guards and shields that fit the male anatomy and can be worn with regular underwear. When choosing absorbent products, consider your level of incontinence, your mobility, your lifestyle, and your skin sensitivity. Many people find it helpful to try samples of different products to see what works best for them. Washable, reusable products are also available and can be more economical and environmentally friendly over time. These include washable underwear with built-in absorbent layers and reusable pads. Beyond absorbent products, there are other aids that can help. Waterproof mattress protectors and chair pads can protect furniture and bedding. Portable urinals can be helpful for people with mobility issues. Bedside commodes can reduce the distance to toilet facilities at night. For people with bowel incontinence, there are specialized products including anal plugs and fecal collection systems. These are typically recommended by healthcare providers and may require some training to use properly. Skin care products are also important. Incontinence can cause skin irritation and breakdown if not managed properly. Use gentle pH balance cleansers designed for incontinence care, and consider barrier creams or ointments to protect your skin. When shopping for products, many pharmacies and medical supply stores have knowledgeable staff who can help you understand your options. Some companies also offer discreet home delivery services, which many people find convenient and less embarrassing than shopping in stores. When to seek medical help. While this video provides valuable information about managing incontinence, it's important to know when to seek professional medical help. Incontinence is a medical condition, and healthcare providers are trained to help you find the most effective treatment options. You should definitely see a healthcare provider if your incontinence is new or has suddenly worsened. Sudden changes can sometimes indicate underlying conditions that need medical attention, such as urinary tract infections, medication side effects, or other health issues. If your incontinence is significantly impacting your quality of life, don't suffer in silence. Many people avoid activities they enjoy, stop socializing, or experience depression or anxiety because of incontinence. These impacts on your life are serious and deserve medical attention. You should also seek help if you're experiencing pain, burning, or blood in your urine or stool. These symptoms could indicate infections or other conditions that require treatment. If you've tried self-management strategies for several weeks without improvement, it's time to consult with a healthcare provider. They may be able to suggest different approaches or identify underlying causes you haven't considered. Don't be embarrassed to discuss incontinence with your doctor. Healthcare providers deal with these issues regularly, and they understand how common and treatable incontinence can be. They won't judge you, and they want to help improve your quality of life. Your healthcare provider might recommend seeing a specialist, such as a urologist, gynecologist, or gastroenterologist, depending on your specific situation. These specialists have additional training in treating incontinence and may offer treatments that aren't available from general practitioners. Remember, there are many treatment options available today, from medications and medical devices to minimally invasive procedures and surgery. Many people find significant improvement or complete resolution of their symptoms with proper medical care. As we conclude this discussion, remember that incontinence is a manageable condition, not a life sentence. With the right knowledge, tools, and support, you can maintain your dignity, independence, and quality of life. The most important message we want to leave you with is this: you are not alone, and you don't have to suffer in silence. Millions of people successfully manage incontinence every day while living full, active, and satisfying lives. Take things one day at a time, be patient with yourself as you learn what works best for you, and don't hesitate to reach out for help when you need it. Whether that's talking to your healthcare provider, connecting with support groups, or simply talking to a trusted friend or family member, support is available. You deserve to live with dignity and comfort. Incontinence doesn't define you. It's simply one aspect of your health that can be managed effectively. With the strategies we've discussed today and the support of healthcare professionals when needed, you can take control of this condition rather than letting it control you. Remember, every small step you take toward better management is a victory. Be proud of yourself for seeking information and taking an active role in your healthcare. You have the strength and wisdom to handle this challenge, and better days are ahead. Thank you for watching, and we wish you all the best on your journey toward better health and well-being. Chat Controls Sonnet 4.